week I had a patient. He is in his 50s, late 50s, and he is a long distance truck driver. And he comes to me and he has back pain, a lot of severe back pain. And after talking to him for a while, figuring out his history and everything, he tells me that he has been on muscle relaxers for the past 6 years. Okay, I'll say that again. He has been on muscle relaxers for the past 6 years. And for you, it might not mean much, but what are muscle relaxers? It's something that takes away the spasm in the muscles, and it's usually something that's used acutely for a problem that just recently happened, maybe an injury or car accident or something like that, that is usually used for 5 to 7 days, 10 days tops. Okay, so this patient has been on these medications for 6 years. These medications are not intended for long-term use, first of all. Secondly, there's so many side effects from them. It decreases the central nervous system, which causes the patient or the person not to be alert enough, which might cause sedation. And hello, he is a truck driver, so doesn't he need to be alert and awake? It also just boggles my mind. Also might cause various other problems, including heart failure and renal problems and liver problems, just to name a few. But another thing in this case is just something that I see over and over again, and it just fires me up, and it makes me want to create a change in our world, in our system, in our country. So this patient, the way he presents, the way he looks, is he is slightly obese, slightly overweight. He has very bad posture. He has protruding stomach, abdomen, because he's sitting constantly all the time while he's driving. He doesn't exercise, he doesn't stretch, he doesn't take any supplements. So I'm not saying anything against the doctor who is prescribing these medications to him, because I know most doctors who go into medicine, they start with an open heart. They want to help people. They go there with the right intentions. But then the system screws them over. System doesn't give them enough knowledge to really take care of patients' wellness. Doesn't give them enough information and awareness. And because there's not enough time, doctors are in survival mode. They have to pay their bills, they have to pay their loans. Most of them don't take the time to educate themselves in these things, and so it just flows how it is. It just nobody looks outside the box. So 6 years that the patient has been taking these medication, nobody took the time to take a look. Could something be causing his problems that could be stopped without the medication? Number one, his posture. Maybe he's sitting in a way in his truck that's causing him pain. Number two, he's overweight, so the pressure that his spine takes day in and day out from the extra weight, and it makes the posture worse as well, is contributing to his pain. Number three, he doesn't exercise, he doesn't stretch. Maybe he has tight muscles, tight ligaments. And the most interesting thing is the patient is very motivated. Patient was telling me that he's ready for a change. He wants to try something natural. He wants to change his life. He's ready. He actually owns his truck business, so he has flexibility of creating his own schedule around whatever it is that he wants, but he just doesn't have information. Nobody ever told him that. He's not educated. What he needs to do to fix his posture, what he needs to do in order to lose the weight, how he needs to exercise. Yes, all these things and all this information is available online easily, but most people are just not aware of it. And as a medical system, I think we're failing people like that who are willing to do the work, but we're not giving them the right information, and we're just feeding them with medications that will cause more problems in the long term. What do we do? What's the answer to this? I don't know. I'm just trying to do my best, and my passion and my mission is to somehow in the future to change this, whether it is to change the medical education system or provide patients with a specific coaches or providers that know how to take care of their wellness and maintain their wellness, and not just take care of and block and delete and try to remove the symptoms, because that's not helpful. It's helpful in the short term, but it's not helpful overall. So that's my thoughts for today. I'm pretty passionate about this, and I see this in different ways over and over and over again. And we gotta be proactive. We gotta start being our own advocates and looking outside the box and really questioning, is what we're told correct? Are there any other solutions to our health, our happiness, our fulfillment? Is there anything that I personally can do? Can I change my life somehow? Can I educate myself, research this topic? If you have back pain, research it, see what holistic modalities you could start using. Start finding out which exercises are good for you, what stretches are good for you. Be your own advocate. All right, Dr. Anya Temer here. Have a good day. Bye.